Your original hometown dealer, Saida, Trudeau Chrysler Jeep Dodge and Ram.
Our COVID trajectory has continued to significantly elevate since my last report. Nye County is among many other Nevada counties that has returned to flag status due to the significant increase in COVID cases. Most new cases continue to occur in Pahrump. However, additional cases also occurred in Tonopah. Specifically, Pahrump is now at 848 cases. Amargosa has risen to 20. Beatty remains steady at 13. Tonopah has more than doubled to 60. Smoky Valley has 4, and Gabbs had 1. That leaves us with a grand total of 947, which is an average of 16 new cases per day. We subtract the antibody tests, those transferred back to Clark County, and 2 repeat cases, which gives us the grand total of 922. So as you can see, we're slowly edging our way towards 1,000. We've also had 2 additional deaths. Hospitalizations are stable in Pahrump. However, increases have experienced up to and including up to 90% capacity in our local hospital. Several of our cases have also remained in both our local hospital and Las Vegas-based hospitals, and at least several are on ventilators. Most of our new cases have had underlying medical conditions. Some have had diabetes, cardiac, or respiratory history. Our target hotspots include our educational, institutional, which is our hospital and detention centers, secured federal facilities located in northern Nye County, religious environments, and family gatherings and activities. One church has been closed until further notice. Our local high school is virtual learning only, and this is the second of the 2 weeks, and several additional classrooms have been closed with students and staff quarantined. Our testing continues with great interest over the last 2 weeks. We are seeing significant lines at most of our testing centers, which is good. However, we have also experienced through COVID tracing that many of our people who are symptomatic are refusing to be tested. So we want to encourage that testing is paramount to understand where we are within the county. We continue working very closely with the state in our preparedness to distribute a COVID vaccination. You may have seen on the news recently that a Pfizer product is nearing completion and almost ready for distribution. That model is a 2-phase vaccination with approximately a 20-day separation between the two. And that would be for a tiered 1 approach, which is for emergency healthcare providers and hospitals and long-term care facilities, with the bottom of the tier including the emergency responders. It is anticipated that a general vaccination for the public would not be available until the first quarter of next year. And as a side note for this report today, many of you have been asking when we're going to be opening the burn moratorium of Pahrump. That is going to open up this coming Friday.